Therapy isn't just for crisis, it's for connection, growth, and resilience. Today, Lenny Gallo reveals how talking about our struggles can transform both the incarcerated and the everyday. Next on DocStars.
Welcome to DocPod's DocStars.
Hello, everyone. I'm JJ, and thank you for joining us on DocStars on the DocPod channel. In today's episode, we welcome Lenny Gallo, licensed clinical social worker and host of the Talkin About Talkin podcast, specializing in CBT, OCD, movement disorders, and much more. Lenny blends evidence-based therapy with creativity and lived experience, which I absolutely love. So today we'll discuss topics like mindfulness for anxiety, telehealth, their role in, of course, modern therapy, and how to find the right therapists, as well as the powerful message he has for creatives, trauma survivors, and those navigating OCD or movement disorders. So, Lenny Gallo, welcome to DocStars.
Thank you so much for having me. I'm so happy to be here.
I'm excited. There's going to be a lot we're going to talk about today.
Yes.
And I try to generally follow a format for these shows, but I think with you and I, with this talk, we might get off a little bit on some tangents because I think you really bring something unique to this conversation, which is really more of a conversation that I think people from a larger group of society can really take something from, which is what I really love. So I want to talk, first of all, about what inspired you to launch Talkin About Talkin, and which listener topics like emotional awareness, mental wellness, or really, healing through storytelling are resonating most right now. So that's exciting.
I was actually very honored and invited by, one of the members of DocPod to host the show for mental health. I had to give it some thought, but I guess what really kind of inspired me to sort of do it was, there's so much misinformation on the internet. I know a lot of people have, podcasts and channels, where they're providing information. And I guess I kind of wanted to give people a sort of general overview of all sorts of modalities in therapy and all sorts of topics in therapy. I think things like, understanding some of the foundations of therapy, being able to sort of, give people an opportunity to sort of grasp onto those concepts. So I know we have shows coming up like we have some on couples counseling, addiction. I definitely want to do some on EMDR and trauma and things of that nature. And so I wanted it to kind of cover a broad range of therapeutic modalities and topics in therapy and kind of let the listeners sort of decide, like, what makes sense. They can take away what they want from it and what sort of makes sense for them.
Yeah, I love it. And you know what I really like about it is the title, Talkin About Talkin, right? It seems very simple, but I think it's much more nuanced, because I think this is the problem that a lot of us have, which is just beginning that dialogue, right? About
Yes.
talking and making it a space where people are okay with talking. I'm sure for you and I growing up, we were in spaces in that time, in that era, without giving away our ages, that you weren't supposed to, or it was maybe a small stigma attached to talking about your feelings and talking about these things. And so I just like the title that we're promoting. Listen, I think one of the first keys to this is just let's begin talking about it, and that makes it easier for all of us, right?
Yeah, making it more digestible for people, making the conversation, less taboo, right? When we look at older generations, or I know people from my generation, earlier generations, there was a bit of a stigma about, receiving mental health care, right? Oftentimes it was reserved for just people who were considered the worst of the worst, right? And today we're seeing a lot of that change, right? I think a lot of this is due in part to like Gen Z, right? They're much more open to talking about mental health than we ever have seen before. They're much more willing to seek mental health services. And I think as more and more people kind of have the conversation, and aren't afraid to sort of admit that okay, maybe there's something going on here, we'll continue to see people getting the best care they need for themselves.
Yeah, 100%. And, I make fun of my nephews a lot. They're 22 or 23 and 25, but I have to give them credit on that front 100% because they will talk about it, and I think hopefully our generation started that where it's like when you're working out, the no pain, no gain theory. We know now the data is in, that's not really the way we should approach it.
No, no.
And so I love that their generation is opening up about it. And you already framed it about how you kind of can talk about things and bring in different topics that people are discussing today. But generally speaking, how do you choose topics, that not only reflect your expertise, which is pretty vast, but also align with some of these trending mental health searches and what's taking place today that we're all kind of hearing about?
So for me, I would say personally, in picking topics, the first thing that comes to mind for me is I want uh, either colleagues I trust. So if I'm going to interview somebody, I want colleagues that I trust, that I know are experts in their field. Um, people who've had experience working with a specific population. Um, that's kind of the big one for me. The other side of that is on some of the more solo podcasts and things like that. Just bringing awareness to sort of evidence-based strategies, right? So I know I did one recently on feeling your feelings, right? And that's a common question I get a lot in therapy is what does it mean to sit with these emotions, right? And so I wanted to give people kind of a little takeaways, things that they could kind of use and, just get them thinking, right? Um, you know, I- the internet is so flooded with so much information right now and can be oversaturated with information sometimes. And so just helping people to kind of navigate through some of that and say, okay, here's some little tidbits of things to try. Here's things that might be helpful for you. Here might be one step on your longer journey of finding care, right? Um, so that's really how I kind of, decide my topics. I want them to be relevant. I want them to hit with certain populations, certain individuals. And that's kind of how I make my decisions about things. And obviously, you know, interviewing people who are experts in their field, people who can, really break things down for people in a way that's digestible.
Yeah, no, 100%. And I think that's what's great about these types of podcasts, whether they are, video first, audio first, you can really break this stuff down, make it digestible for people. And I think when I think about anxiety, for example, this is something that I think all humans have at certain points in our life. Some have more, some have less.
Mhm.
But I think all of us, people watching and listening today, are searching for mindfulness. And we hear this word thrown out a lot, right? And
Mhm.
we're searching for mindfulness to understand more how we can deal with our own anxieties. So, how would you explain the benefits of these approaches to someone listening, even like myself or listening today, more on a practical level and what that means and what it looks like?
So, with regards to mindfulness, I think mindfulness is a very generic term, right? It's something we hear a lot about. I don't know a person who hasn't at least come across the term, and I think the general sort of understanding of mindfulness is that it's this idea of how can I be as present as possible, right? How can I be as present as possible in the moment? Which if we look at some of the therapeutic modalities, a lot of them will incorporate some sort of element of mindfulness into it. I like to look at this, in a little bit more digestible way because whenever I bring up I don't even use the word mindfulness with my people because I think they hear mindfulness and they think, oh, you're going to want me to meditate, right? You're going to want me to do some sort of
Exactly.
yoga, um, and that's not quite what mindfulness is. And so mindfulness is, I like to think of it as having an awareness of what's going on inside of us. Can we have almost like a second brain? Can we have this sort of awareness around us of what's going on and really be able to sit and tolerate physical sensations in our body, thoughts that are running through our brain, emotional experiences, right? Um, and not necessarily have to act or fix on that, right? Or to fix something like that. Can we just be aware of it, learn from the experience, allow the emotion to sort of pass through us, allow ourselves to be in these states? We forget as human beings that we're supposed to feel all sorts of feelings, right? We're not just designed to feel good feelings. We're designed to feel all sorts of feelings. And when I think of mindfulness, I think of how do we learn to tolerate all of life's experiences, right? And some life experiences can be really challenging and really difficult. Some are a little bit more, some are a little bit more difficult to sort of maneuver through. And so mindfulness can really become a practice of, teaching your body to sort of be present with all of these different things, right? Um, so when I'm working with people in mindfulness, for example, can we become aware of what's going on in our body? Can we become aware of our thoughts? Can we not judge those things, right? Can we allow ourselves to be present with them? And so if I'm working with somebody who's got anxiety, for example, um, anxiety is kind of one of these, true traditional clinical anxiety is, we can't stop our brain from running, right? We can't stop those
Mm.
anxious feelings from coming to us. Can we learn to start to be more of an observer of that and to not get caught up in that sort of, runaway train, so to speak? And so a lot of the work I do, specifically around anxiety disorders, the mindfulness I would approach with that is like learning to observe, I guess is the best way of saying it. And I know depending on the school of thought and depending on the therapeutic modality, they will have different definitions of what it means to be mindful, or what it means to get closer to mindfulness. If you look at something like internal family systems, for example, which is a therapeutic modality, right? They may call it the self, right? Getting, allowing yourself to be closer to yourself, right? How do we get to that core essence and self a little bit more and let that lead the path? In DBT, they will have, a dialectical behavioral therapy. They will have, emotional regulation skills, right? How do we learn to just be present with all these big feelings and things like that? So, depending on the therapeutic approach, mindfulness will take a sort of different, people have different views on it. But again, the simplest sort of explanation for me, at least, and how I explain it to my patients is, can we be present with all of this stuff that's around us?
Yeah, 100%. I like the word awareness, right? Because I think I tell my nephews all the time, I said, one of the greatest skills you can have is self-awareness.
Hmm.
I see a lot of that today, or at least a lack of that in people. And it's something we all have to work on. But I do like that, because I think that sometimes people talk about mindfulness and the word gets thrown out so much that then eventually within our culture, somehow people don't want to hear that word anymore and they almost
Now
get frustrated
it
by it,
loses its
right?
power, right? It loses its power.
Exactly. Exactly. So I like awareness. I think that's something that we might be able to change the narrative with. And so could you share maybe a success story you had without giving, people's details and everything, but you've had a lot of these types of experiences where you're working with people. And I'd love to know a success story where that awareness had a measurable impact for you and what you were doing.
Um, so I guess one that comes to mind for me is, and I guess this is, I would say I've had a lot of success stories with OCD, right? Because
Yeah.
that's one of these areas where mindfulness, I think, is a key component to treatment of OCD. And so, I'll give a more general sort of answer in the sense that, you know, it is so gratifying to teach people how to be present with their thoughts. For those who don't know OCD individuals will have intrusive thoughts, right? So it's all these sorts of thoughts running through their brain that they can't stop, and sometimes these thoughts can be like really horrifying, right? They have a thought like, oh my God, what if I wanted to kill my mother? And their brain just goes like wild on this idea. And so teaching people to understand that that is just a separate part, right? That is not you, right? That is the OCD kind of coming in. Can we learn to differentiate a little bit between the two? Can we learn to be present with this like OCD monster, right? Because OCD it's something that is managed throughout the course of life, right? Um, you're going to have intrusive thoughts kind of coming into your brain over and over and over again. How do you learn to sort of live with that? How do you learn to sort of tolerate and be with that? And so I think one of the greatest moments for me is when a patient sort of gets it. They're like, oh, the more I stop fighting this, the easier it becomes, or the more I lean in to the fear and tell those thoughts like, so what, the easier this becomes. And so those are the powerful moments I love about being a therapist. Or, even in working with like EMDR, just witnessing patients process through years of trauma and all of a sudden saying, this doesn't matter anymore. Um, those are the things I love about being a therapist, and those are the success stories, if you will. Um, but yeah, those are that's the powerful elements of being a therapist and getting to witness that, and you know, uh, being having the luxury of being invited into someone's life and for them to share that with you and to go through that process with you.
Yeah, it must be amazing as well because you hear it and you see it in real time,
Hmm.
right?
Hmm.
And that's incredible. So, obsessive compulsive disorder,
Hmm.
OCD, is this something that a lot of us have? I'm very curious when I think about a subset of the population that has this, because you mentioned earlier people have certain thoughts. We all have these thoughts that enter our minds. And then
Hmm.
a lot of it comes down to what are your actions? If you don't, you can have those thoughts but I'd be very curious to know if there's actual data out there that says X% of us have OCD. What does that look like today? What do you
So
know?
the numbers will vary on this based on age, gender, um, uh,
Race,
historically,
even maybe?
uh, possibly, yes. I mean,
Possibly?
we're what we think we know about OCD is that there is some sort of genetic component, which may get triggered by the environment. Um, why someone in a family will, have OCD versus like a brother may not have OCD. I think there's still a lot of research that needs to be done in that area. What I can tell you is that OCD oftentimes gets labeled as like everyone has OCD, right?
Yep.
Um, it's like, oh, I clean a lot, so I'm OCD, right? That's not
Exactly.
that's not OCD. Um, true OCD is it's kind of like having like almost like a radio of like just negative and disturbing thoughts going through your brain constantly. And what happens to someone with OCD is they get hooked on these thoughts and believe that these thoughts are actually reality, right? Um, which is different from something like schizophrenia. They recognize that this is not true, right? They recognize that these thoughts are not real, but the struggle becomes in how to sort of manage and deal with these thoughts. The other component of OCD is the um, compulsive nature with which things are done. So, um, they might have the thoughts, but in order to stop those thoughts, they'll do something very compulsive in nature. So, for example, like washing your hands repetitively. So some people, I'm just going to use a classic example of like, maybe there's a fear of contamination, right? They're going to contaminate their body on some way. They get these thoughts saying, ooh, this cup is contaminated, this computer is contaminated. And so they'll do things to sort of avoid having to confront that fear or that thought in their head. Um, so I think a lot of people who really struggle with OCD, they get very offended by people who call things just, oh, this is so OCD because you like things a little neat. Um, that's not necessarily what OCD does. OCD can be very invasive on a person's life. It can be very. There are people I work with who can't leave their house because they're just terrified of what the world might look like. There are people who stop going to their job, school, things of that nature because they're unable to function because they get so caught up in the thought process. And so a lot of what we try to do with that is exposure therapy. How do we get you to kind of confront some of that stuff? And how do we get you to embrace this idea of uncertainty? That's the key to working with OCD is how do we tolerate these uncertain thoughts and not give power to these thoughts, right? Um, so yeah, with OCD though, I know it gets thrown around out there. OCD and trauma specifically, right? Trauma is the other big one, and I never want to minimize anybody's trauma. I think we can have big traumas, we can have little traumas, um, but what we're looking for as therapists is how does the body respond to that trauma, right? You may have gone to war and, I may have gone to war and you might come back traumatized from that experience and I might not. Um, Even though we witnessed the same things. It's how the body is ultimately responding to the trauma, right? Am I having flashbacks? Um, Is my body dysregulating? Am I, in my relationships with people, am I, shutting away? That do certain people in my life remind me of past experiences? So there's all these sorts of things we look at. And so with OCD and trauma, I'm always very conscious to make people aware that we don't just throw around those terms lightly, because true OCD, true trauma can severely and negatively impact someone's life to the point where they can't function.
Yeah, yeah. And what I'm hearing is that to the point where it's controlling you, right?
Hmm.
In many periods or many situations in your life. And I'll give an example. I had a friend who pretty sure this was OCD. It helps kind of clarify it a little bit for me, where she would leave a room and she had to flip the light switch four
Hmm.
times on and off before she left every
Yeah.
room.
Yeah.
And that was one example. Or she had to, touch the pillow a certain way
Yeah.
and like three ways before she could leave. And to me, that is OCD. Would that be considered? Yeah.
That happens oftentimes in OCD. That's another classic example of OCD. It's just not right. It's just not right. We like type OCD, where the pillow needs to be touched in a certain way. We have to touch
Yeah.
the light switch 3 times, because what we're looking for in those sorts of moments is, what are the thoughts behind all of that? What happens if you don't do that? And that's what we're trying to confront at the end of the day with OCD: is, if I don't do this in this way, what happens? And once we can understand what the fear is behind all of that, that's when the real work can begin. But that would be a more classic example of OCD. Yes.
Yeah, 100%. I've seen that. And it's good you mentioned so we understand the differences, because I do hear people, I'm a clean freak. So I like things very organized and very clean. And people are like, oh, you're so OCD. And I'm like, I don't think that is, but I do think that if it started controlling my life where I couldn't leave my apartment ever because I want to see everything perfect, probably I would have a situation. But if I just like to have it clean, probably not so much, right?
Yeah, yeah, and part of that can just be part of your personality.
Yeah.
Some people just like things clean in certain ways, and I'm not a big fan of overly diagnosing things, because I mean, the real reason we have the DSM, the Diagnostic Statistics Manual, which has all of our diagnoses in it, um, it's really for insurance purposes. We have to give you something in order for sure insurance to sort of reimburse. But if we look at just the human condition, right? Does your cleanliness impact your life, right? The same thing might be said of like people like with drinking. Does your drinking impact your life? Does your does your behavior, is it causing distress in some way? And that's what I really like to work with. Diagnostics aside, um, you know, sometimes people will present with very classic sort of symptoms of something. Okay, maybe we can put a diagnosis on that, but overall, the diagnosis doesn't matter as much as what are we doing to treat this.
Yeah, no, 100%. And that's good. So now we can dig in a little bit and talk about more the operational side of therapy. And I
Hmm.
think this is a really interesting part because for years, I think there was a stigma towards maybe going to see somebody about therapy. And one of the areas I've seen with technology, especially since COVID, as we know, is that there are some really great advantages and challenges. When someone like yourself, is providing therapy via telehealth, right?
Mm.
Via almost like we're doing right now. And I think I'm a positive person, so I think, wow, that could create so many benefits. Getting over
Hmm.
the stigma, people don't want to have to go to someone's office to speak to them, whatever that looks like. But I'd love for you to speak a little bit about what that's looked like for you in your sessions, the advantages and the challenges of that.
Um, it's funny you bring this up, because I have a whole episode coming out on just this topic of the pros and cons of telehealth and teletherapy.
Perfect.
Um, but okay, I will say that I'm a huge proponent and fan of telehealth. I think it has been a game changer. Prior to the pandemic, people were doing telehealth and teletherapy, but it was really not what it has become today. It was really just reserved for people in remote areas, people who didn't have a lot of access to care. There were very few clinicians who would do it. Insurance wouldn't reimburse it. And I should say today, they don't always reimburse it as well. This is still a big problem going on. But then the pandemic hit and everyone was kind of forced to have to change. And what we realized is that, hey, therapy can be done via telehealth. There was modalities that we were like EMDR, for example. It was always thought you should be in person for that. We find that today you can actually do that virtually as well. And so what I love about telehealth is it has given me as a clinician the opportunity to reach out to people who I might not otherwise get a chance to work with, right? That child who might be struggling with OCD issues in a more remote area, who maybe doesn't have an OCD specialist around them. It's wonderful to be able to be the person who can kind of like help them through that, right? Or um, people who are really afraid to go to therapy, sometimes just, it feels a little safer on your computer, like, there's a little bit more control to it. And it can sort of, open that door for people to go to therapy. Now, I will say, teletherapy does certainly present some challenges, and is not for everybody. Um, Not everybody has a space where they can speak privately. Not everybody has some people fear that like their family is going to be listening. If you're struggling with, something that's very deep, I often hear this from my clients who are struggling with like a sex addiction, for example.
Mm.
They don't want their family to be around as they're talking about something like that. That's a very hard thing for them to admit, and then to have to add that layer of stress onto that. That can be very difficult. Another challenge, obviously, is just technology doesn't always work with us. Um, I will say it never fails. Someone will be in the middle of a very unburdening, releasing process of feelings, and then the internet goes out, or then there's the glitch. So that's something that has to be kind of worked through. I think a lot of the issues, though, that I see with telehealth that are problems can be addressed upfront if you really educate the person on telehealth and how telehealth can be beneficial. Making sure that you're in a space where you have privacy and decent Wi-Fi connection to minimize those things. And if it happens, we get on the phone. We figure our way around it. Um, but there will always be some therapist and people going to therapy who want to be in person, right? Some people like that sort of ritual of going to a space, going to an office, feeling like this office is theirs for an hour, right? And they can release there. And that's not bad either. So I think there is room for both. If you're on the fence about therapy, I would say certainly give telehealth a try. It's that, once people actually try it and they realize that it's not as bad as they thought, they can generally they can generally adapt to the process. Some people just will always prefer in person, and some therapists too prefer in person. I think what we're seeing a lot of today is the hybrid model, where therapists have an office like part-time, and they do telehealth part-time to accommodate the needs of both. And I think we're going to see a lot more of that in the future, is this sort of hybrid model where we might do some in person, we might do some telehealth. Maybe some people will only be telehealth, some will only be in person. um, there is something to be said about being in the space with somebody, right? Feeling their energy, feeling their, having their full attention, right? Some people are just too distracted for telehealth. So, but I think it's a wonderful thing. I think it has certainly given people an opportunity to really go to therapy in a way we've never seen before.
Yeah, 100%. I also think that some of these things we can overcome. The
Hmm.
technology will get better,
Hmm.
right? The more we use this stuff, the easier it's going to be. I remember a lot of us using telehealth first on the phone, and
Hmm.
that was talking to a doctor, and you're like, okay, now it's kind of common. And then you
Hmm.
add video to it. So I think some of these things we'll be able to get over on the tech side just because we get used to them, right? Just like before you drove and you took an Uber and you were like, oh, I'm scared to do it. And then after a couple of weeks, it becomes normal. But I do think the proximity, that is something that's interesting because I didn't think about that. I don't want to be talking, too loud if my family is right on top of me and they're hearing everything I say. So I think that's a very good point. But I do think that it's great that you give people these options. I would
Hmm.
want to know about that. Do you find that if you're doing, let's say, this type of telehealth therapy, that you can go deeper and you feel a closer connection when they add video versus say just the phone? I'd be curious to get your thoughts on that.
So I will tell you, I only do video, making
Okay.
sure that we have a video component because that is what insurance requires at this point. And I personally, as a therapist, do not feel comfortable not being able to see somebody. Um, Body language is important on some level to
Yep.
the therapeutic process. Now, generally, the view I get of people is probably about the view I'm getting of you and me right now. So I can let some of that go as a telehealth therapist. But I do want to see the person. And what I love is being able to see their space, right? Uh, Not everybody has these nice little backgrounds. Some people will show me like their space, and this is really important when we're doing things like exposures as well. Because I can actually walk somebody through an exposure in their household and make it more effective. I can see their living environment and just how they're sort of operating on that level. Um, I love it when animals come into session, right? The dog comes in, the cat comes in. How are they towards that, right? How are they towards their animal? Um, Lots of telling details and all of that kind of stuff. So, yeah,
Yeah.
yeah.
I love that. I love that. That's really interesting. And, one of the things I always talk about when it comes to the US, because I lived outside the US for a long time. And I always tell people, my friends who are not from the US, you have to remember when they say, oh, well, how is this in the US? And I say, well, you actually have to think of it more like, how is this in California or Florida or New York? Because all states are different, right? We have different laws that govern and that sort of thing. And when I was doing the research on you and I was thinking about understanding the operational side, with licensing and logistics and all the barriers there, are there issues when you're dealing with those between multiple states with telehealth, or is it kind of a one size fits all and it just covers the whole US? I'm guessing not.
No. So, but we're getting closer to something like that.
That's
So
good.
I know for psychologists and psychologists, licensed professional counselors, they have a pact. So basically, with if you are licensed in one state and you join this pact, you can practice in multiple states. You're allowed to practice in these states. The states have agreed to say your credentials in your state are equivalent to ours. Social workers and LCSWs like myself, we have one as well. I know it just got passed in New Jersey, where I'm based. Um, it should be rolling out very soon. It gives us access to more states. So this is actually a good thing because it allows clinicians from, all walks of life to be able to access, people in various different states. Um, it's I think it's a wonderful thing. I think it's a really wonderful thing. I know some clinicians are not as in favor of this. They prefer to practice with people uh, in their state, at least, where they know the resources a little bit better, right? Um, if I'm working with somebody in Colorado, for example, I don't know Colorado's resources as easily. So if I need to make a referral, it might not be as easy to do that. Um, but so pros and cons to all of this stuff. But yes, there are certainly restrictions. Every state has its restrictions on how telehealth can be implemented. And, it is your job as a clinician to kind of have to figure out what those restrictions are, what their requirements are. Um, in order to be able to practice and to be able to do telehealth.
Yeah, that's a great point. I didn't think about it that way because I'm always thinking you're having therapy with someone, you're in a therapy session, you're talking to someone, you're having a conversation, but that's one part of it. Part of it is
Mhm.
then you might also need a resource to attach that to, like a practical application. And if you don't always know those resources, I think that's a really interesting point. Yeah.
Yeah, yeah, and not every it's not the easiest. This is still an evolving field, and I think we're going to see how this sort of continues to pan out and play out as time goes by. But the fact that we're allowing it now, and that the pandemic did teach us that so much of care can be gotten virtually. Um, It's good. It's a good thing overall. People don't, have to wait necessarily months to find a therapist. They're not limited by like their radius of like, okay, these are the 20 people I can drive to.
Yeah, that urgency is amazing because if you need help right now and you want to speak to someone,
Mm-hmm.
this is a wonderful way using a telehealth kind of situation. So, if for the people listening today and you want to give them one message that, if they're dealing with anxiety or OCD or some sort of trauma and they're listening, in terms of healing and resilience today, what would that be?
Um, well, I think for all those, conditions you mentioned, the theme for me that stands out amongst all of them is leaning into the suck, leaning into the difficult stuff. Um, you're, when you first go see a therapist, or if you're going to see a therapist, I think a lot of people are afraid because they're like, they know something needs to change. They just probably don't know what needs to change. um, and that's why they're coming to us for help. That's why they're coming to seek us. Um, and so my message is about, embracing this idea that we all have to lean into the difficult moments of life. Um, and I know that can be so incredibly hard, and I don't want to minimize that for anybody. If you're struggling with a death of a family member, intrusive thoughts, right? Some sort of traumatic experience that happened in your life, that is very painful, and we're asking a ton of our individuals to be able to sit with and tolerate that and work through that. But the more and more you lean into this stuff, the more and more you lean into the difficult aspects of the situation and the feelings and the thoughts, there's where the real healing begins. And so this word resilience, right? It's something I use a lot in my practice, teaching our bodies how to build resilience. And sometimes the only way to do that is to walk through the fire. Um, and I think that's really scary when people have to think about that. And I think that's also what kind of keeps people from coming to therapy sometimes because, they know they're going to have to do something, but they may not be ready to do that. And so I would also say, a good therapist will also meet you where you're at and work with you where you're at, and will help you walk through that fire a little bit easier.
Yeah, and it's not easy. It takes courage, right?
Hmm.
It takes, it's really difficult because I think most of us, we just think we kind of bury our heads in the sand. I don't want to deal with it. Eventually, I'll get through this. I'm not going to speak to anybody. And so, like you said, you have to first confront it. You have to make sure that on the other side of that courage and discipline generally is freedom, right? Where
Hmm.
you get beyond that problem. And I think just talking about it first and foremost, and we'll talk about that, I think, again, as well later in the show, because I will also want to get into that because it seems easy when we're like, oh, just talk about it. But there are probably some, more difficulties there than we think in terms of just talking about it. I do want to touch on that, but I also want to mention and kind of discuss what you just said. The message that you're giving doesn't apply equally to all of us, right? I know you work with artists, creative types, you work with corporate professionals. Also, in the show, we'll talk about some of your work with maybe men and women who have been incarcerated. So we're all different. We all come from different backgrounds. But how do you adapt that message as an example for some of these different groups of people? Because we're all different, and that must be a challenge.
So it is, but I will say that this is where we start to look at things on a very individual level. So, my performers that I work with, for example, right, my people who are artists and actors, for them it's can we embrace this idea of the uncertainty of, okay, I'm don't know if I'm going to have a job after this one. Is this the lifestyle for me? Do I want that? Or having to sort of navigate through some of the performance challenges and things like that. For somebody with OCD, can I lean into this idea that okay, maybe this is as good as it gets with these thoughts, right? I've tried the medication, I've tried, uh, you know, minimizing them as best as I can, but now this is what I'm left with, and this is what I have to sort of sit with and tolerate. For trauma, can I go back to the experience and let my body sort of tell me what it needs to heal? Um, or is there a person in my life who I need to sort of either reconcile with or remove from my life? And so I think, everyone will have a very unique challenge with this. And this is where, when you come to therapy, I think a good therapist will, get this data. We'll do an intake. We'll work with you to kind of see, okay, what's the core of all of this so that you can move into that space easier.
Yeah, no, this is great because It's all about that, right? Making sure we break down the friction that there is between even getting started, which is a great transition into what I want to talk about, which is what does that look like? So I'm someone who maybe I think I have an issue. Maybe I'm the guy who, is turning on the light switch all the time, or I feel like I have some sort of issue going on. How do we find a therapist, and access these resources that are available to us? Because I think it's easy for us to say, oh, yeah, just go talk to a therapist. But in reality, it's probably much more difficult. But what does that process look like?
So it can be difficult if we let it. So I guess I'll give a plug to my favorite therapy website for finding a therapist. I'm a huge fan of Psychology Today um, because you can go on there and really refine your search by location, telehealth versus in person, insurance companies, conditions treated, right? And you'll be able to get dozens and dozens and dozens of bios of therapists. So you will have to do your work of researching, right? Then you can call these therapists and you can find out, like, okay, what's their availability? How do they work with your specific condition? So whenever people are looking for a therapist, Psychology Today is usually the first source I send them to. There are other platforms like that. Some states, Good Therapy tends to be a reputable resource. I personally am not a fan of some of these big box therapy companies. I think they're too quick to pair people with people they may not know, so you may not have a chance to interview your therapist right away. Um, I know. I feel like with the big box companies, and I won't give any names, but people have probably had their Facebook feeds invaded by them or their Instagram feeds. Um, they tend to kind of rush to put people in therapy and don't always have you don't always have a chance to see who you're going to work with. And so I personally think it's very important to interview your therapist. The other thing I will say is if you need to use insurance, some people do need to use insurance. Check out your insurance website. They may not always have the most up-to-date information, but you can see if a provider that you're looking at on like Psychology Today is in network with your specific plan. Um, so that would be my first resource for people. I know people who have Medicaid, um, they tend to have the hardest time finding therapists because uh, Medicaid really, there are so few therapists who take Medicaid
Hmm.
due to all of the requirements with that. Another great service I will tell people if you are struggling to pay for therapy, you don't have the resources. There's great services like Open Path, which will allow you to look at their therapists and their therapist on that website specifically who have agreed to take people who have limited funds, right? So that you're not paying an arm and a leg for therapy. So that's those are my first tips for people for finding therapy.
Yeah, and those are fantastic. And one thing I noticed though is that when you go on YouTube or when you're on any site or even when you're just searching on Google now on AI, there is some negative public perception, right, towards therapy. We've all seen it
Oh yeah.
sometimes in a Saturday Night Live skit, or someone says, "Oh, you don't need therapy, just suck it up." And that's the old way, right? But how do you respond to that kind of backlash? And when people are giving negative public perceptions towards therapy, what's the best way to combat that?
So I think where I've seen this the most more recently is places like TikTok. Where I forget the actual hashtag, but there is a hashtag for bashing your therapist. Um,
Hmm.
and I everyone has a right to sort of express their opinion about how they feel about their therapist and therapy. I would just say that, you know, I could probably do a whole show topic on just this concept alone. The idea is, there are great therapists out there, right? There are good therapists who are doing their job, who are helping people, who are making changes in people's lives, helping people to make changes in their lives. There are some not so good therapists out there. You as an individual are going to have to be your own advocate and suss through, is this person a fit? I know when I meet with people, I like to give it like 3 sessions just to sort of like say, okay, And then I check in, like, where are we at? Where are we at with this stuff? Is this the direction you want to move, or is this not the direction you want to move? Or maybe I see something in a patient where I'm like, yeah, what you're presenting to me is not something I specialize in or can work with. Um, that's my philosophy. Right? Let's see where 3 sessions goes and see if we're connecting at that point. If not, let me refer you to somebody who might be able to. Um, but uh, we have to be honest. There are therapists out there who do some unethical things. Um, there are therapists who don't always have the best boundary setting. And so those patients will take to social media to as a backlash. So it adds an extra layer of accountability on some level for a therapist. But um, whenever I have a patient who um, we're not we're not meshing in the right way, I'm very direct. I like to talk to them about it. I like to say, like, why are we not meshing in this way? Like, what's going on? And bring it up with them, because I think people respect that. And I think people respect when you're saying, hey, like, I recognize that maybe we're not connecting. What do we need to do here? So um I think for therapists, right now it's kind of like it's another report card that we have to deal with, right? People have always been able to leave reviews about us on, websites. They're still doing that. Google all the websites out there for medical professionals. It's our job to do the best we can to address the patient needs, and when they have a problem, to address them as best as we can. I don't think we're going to stop this. I think people are going to, as long as there is social media and the opportunity for people to express their opinion, they're not going to stop it. So how do we lean into this, right? This is that. How do we as therapists lean into this and embrace this idea that some of our patients aren't going to like us, and that they may say negative things online about us, which is okay. I mean,
Yeah.
yeah.
Yeah, and I think that's a great point. And also I think it's a comfort level, right? And
Mhm.
so when I think about, okay, if I went to a therapist and you touched on it, if I don't feel 100% comfortable with that therapist, which I would think if you're new to it anyway and you haven't had therapy, it's not going to be like super easy anyway. So you need to
Mhm.
give it a certain amount of time, right? But then after that point of time has come up, maybe 2, 3 sessions, as you mentioned, if I'm not comfortable, instead of just bailing on that therapist and quickly finding another one, maybe we can talk about it. What's going on here, as you mentioned, which I think is great. But at some point, is it okay if even after I've talked about it with a therapist, for me to search and look for another therapist? Is that going to upset the therapist? I mean, am I doing the right thing for myself? What does that look like?
Absolutely. No, listen, we as therapists do not want to see people who don't want to see us. We don't want people on our caseloads who don't feel connected to us. We want to feel connected to you, and we want you to feel connected with us, and like we can help you. Um, and good therapists will be able to say things like, you know what, let me help you find somebody who's maybe more in line with what you're looking for. Um, you know, so much of this can usually be sorted out in those early sessions, because you know sometimes you get people who are coming to therapy who want like a very structured sort of approach, right? They want, like, I want you to give me homework, I want it to be very structured, I want actionable things I can do, right? Some people don't like that approach. Some people want someone where they can just say what's on their mind, right? They might want a more, fluid sort of session. Some people want skills. Some people want um they want to process through past stuff. Some people don't even want to talk at all. They want to do things like EMDR, for example, right? Um, and so recognizing that in yourself, and that's really important when you're trying to find a therapist. It's not even so much just, okay, do you do this certain modality? Do you do this certain thing that I read about online? Um, how do you treat what I'm dealing with right now? What's your approach to what I'm dealing with? So that's the question I would ask of patients when they're interviewing therapists up front is, if I'm dealing with anxiety, what's your approach with that? If I'm dealing with OCD, how do you tackle that? How do you work with somebody with these types of intrusive thoughts? That will give you data as a patient to say, is this therapist going to be much more behavioral, psychodynamic? Are they going to be the kind of therapist where I can bring anything to? Or is this going to be like, teacher with the lesson?
Yeah, and understanding their process of how they can help you, right?
Hmm.
As even as a patient and knowing that. And that's really interesting because then I think to myself, what do those metrics look like? Is it a simple outcome solution, meaning that if I go to a therapist and I have OCD for the light switch thing, as we were talking about, and then I guess if I've fixed that after a certain period of time, it's been great. This therapist is right for me. But what if after a period of time it's not fixed? Does that mean that's the wrong therapist, or I just need more therapy?
Well, and this is where I think it will be very individual, right?
Okay.
Because sometimes, yeah, sometimes you might need more therapy. Sometimes, you may not be ready to make the changes that are required of you. Okay, so we're going to have to spend more time talking about what that's about. Um, Sometimes it is a fit issue. I will say in defense of therapists, we don't know everything. Um, any good therapist, I think, will admit that, I can tell you a lot about certain conditions, but I can't tell you a lot about other conditions as much. I can tell you a lot about certain modalities, but not every modality. And I think what happens oftentimes is people might come in with one condition and then another condition pops up, right? So that's where we sort of see that kind of happening, where somebody might be in therapy longer than originally intended. Um, and that's where, it's our job as clinicians to be able to recognize that and say, ooh, for this you might have to go over here, or this person might be a better fit for you with regards to this, or here's what I can do with this, are you willing to try and explore some of that? But it will always be very individualized. I don't usually like to set a time frame on therapy because um, some people see me for as little as 3 sessions and that's it. They're good, right? Some people see me for upwards of a couple years. And um, and I'll also say, for people who are in therapy long term, some people just like to have a space where they can talk about whatever's coming up for them. And that's not a bad thing either. Some people don't have the people in their life, the resources in their life to be able to talk about some of this stuff. So for some, therapy is much more a lifestyle where it's like, this is my space where I can go and I can talk about whatever I want here and not feel judged. I think there's this value to that as well. And so knowing what you want as a client will help you find a better therapist.
Yeah, exactly. And it's very interesting because I think a lot of us think, oh, well, I just want to vent to someone. And we've all heard if you're married, if you have a boyfriend or girlfriend, and you're like, yeah, I'm just doing therapy with that person right now. I'm just letting them vent and tell me about everything that's going on. But I do think that there are plenty of us who don't have people to talk to. And sometimes you do need to just get things off your chest and talk about it and discuss it. And it's
Mhm.
good to not keep those things in. So, whether they want to label that as therapy or whatever, I think you're 100% right that, it's something that a lot of us need to do and should do, right?
Yeah. Yeah, and some therapy modalities will be more skills based, right? Some will have a little bit more of a structure attached to them. Some will be a little bit more flexible. Some will have time frames on them. Some will not, right? Um, and so I think it's, and sometimes you might treat one condition and another thing pops up, and this is where me as a therapist, I go with the flow.
Yeah, which is perfect. One thing when doing these conversations on the DocPod channel here on DocStars with some of the previous doctors I've interviewed, as well as healthcare leaders, other counselors, and incredible therapists like yourself, is that I hear the same word over and over when I would say, well, what do I need to do to make it normal? And all of them say the same thing. We need to stop saying normal,
Hmm.
because the reality is we're all different. I would say, well, what can I do to paint this so we're all fixed properly? And they're all saying the same thing. Everyone is different.
Everyone
So
is.
every single one of these solutions is going to be individually based, right? Based on
Hmm.
the person you're speaking to, the person you're working with, because we all are individuals. So we have to get away from that. Oh, well, this works for you to work for him. I mean, everybody is different, right?
This is true, right? We see it with medications, right? Some people respond well with
Yep.
medications, others don't. We see this with therapy as well, right? Talk therapy. Some people respond better to certain interventions while others don't. Um, and so, unfortunately, when we're dealing with our health, our mental health, some of this is trial and error. Um, but you, as a patient, can advocate for yourself, and should advocate for yourself, to make sure you're getting the care that you need.
Yeah, exactly. And something else I want to transition to is that before we came on the show, we were talking about some of your experiences in providing therapy to people who've been incarcerated.
Hmm.
And I think this is a very interesting subject, also because I have a good friend who was incarcerated for 2 years when he was in his early 30s. And now, 30 years later, he's produced this incredible life for himself. And I think a lot of times we think, oh, well, this person's been incarcerated. They're not going to have a great life. They're not going to be able to go out and live the life they want. But I think that's just not true. And when you're working with incarcerated individuals, you often encounter people who've spent years probably suppressing their emotions or avoiding, vulnerabilities, that sort of stuff. I'm wondering what shifts, when someone in that environment begins to open up and actually share their story. And more importantly, and we'll talk about this, is that what can all of us learn from that? You know what I mean? There's a lot of courage it takes to get there. So just talking a little bit about that, I think is very, very interesting, some of the work you've done.
Sure, sure. Everyone wants to hear the stories of the jail. I will tell you that working with the incarcerated individuals, probably one of my favorite jobs I've ever had in my entire life. Um, it is truly a blessing to be able to work with individuals who are at the bottom, trying to work their way back up and trying to offer support and help to them. I hands down, if there are new clinicians out there or students, I would highly encourage that you consider a jail or a prison as an internship, because there's so much value to be learned from working with individuals who are just really struggling. Um, in general, um, working with incarcerated individuals, it's not easy because, many people who've been incarcerated have not had a support system growing up, right? So if we look at their history, we look at their background, um, they don't have the same upbringing that others might. And so, it's easier for them to kind of slip down a path where it just keeps going and going and going. And then once you become incarcerated, now we get the challenges of, okay, now that you have some sort of record, making it more difficult to find a job, making it more difficult to sort of move on. And so, part of the work in counseling individuals in an incarcerated population is really sort of meeting them where they're at and taking the small steps that you can to create change in your life, which oftentimes, like the biggest thing with working with incarcerated individuals is you have to gain their trust. And that is really hard. Oftentimes a lot of people who get incarcerated, they're very skeptical of the police, the social workers, the doctors who are there. Um, they haven't maybe had good experiences with them in the past. And so part of the work is, how do we disarm them? And that was always the fun part for me, is getting people to disarm. I was very fortunate to run a drug program in a facility, and uh, getting to do things that were a little bit more creative to get people to open up about their stories, and to work through some of their stories. And, you know, unless you're working with long-term imprisoned individuals, who are incarcerated and, in prisons for like years and years and years, when you're in a jail setting, we have a very limited amount of time with somebody, like up to a year, maybe a couple years. And so we have to get people to that next step. And that was always kind of our goal. How do we get you to this next step? How do we get you to continue this process, not just here, but when you go out? Um, and it's so challenging for many of these individuals, because they come in, they sometimes get an opportunity to open up with us, to work through some of this stuff. Addiction, really huge in incarcerated populations. They might get a chance to work through some of that. And then we're sending you out into the world and saying, okay, now we hope you have enough resources to actually make this work. And some people will succeed and some people won't. One of the questions I used to get all the time is, with recidivism rates being so high, what's the point in some of this work? And I would often say to people, if just one or two people succeed beyond that, is it not worth it, right? Do we not owe people the opportunity to try again? And everybody gets it at different points in their life, right? if you were to tell a 20-year-old, oh, maybe you should cut down with some of the behavior you have going on, they might not get that until they're 30. They may say, oh, wow, yeah, now I should do this. Same thing is true with an incarcerated population, right? So we meet them where they're at, we work with them where they're at, we build their trust, um, and then we help them as best as we can with their individual situation. And it is wonderful to see people making changes in their life where they can with so little.
Yeah, agree. And I think what you said was really important, which is if you just find that one person, which I have, again, a friend of mine, as I mentioned, who did see somebody and help them overcome maybe some of these disadvantages they had earlier in life. And when they've been incarcerated, that they go on and are an amazing person in life. Just that one story is enough to be like, this is all worth it, right?
Mm-hmm. Mm-hmm.
Yeah.
I know when I worked at the with incarcerated individuals, I know I changed some of their lives. I would get emails and letters and phone calls from people who were very grateful for some of the support we were able to offer them, and to really get them to unburden their problems and trauma, right? And because uh, one of the things we used to do in our drug program was we used to require people to give us your sort of history, right? If you wanted to be on our program, you've got to give a little mini presentation on your history. And hearing some of the backgrounds of people, it made sense how they, got to this path and this point in life. Um, but that gave us so much valuable information where it's like, okay, now we can start to work with you in a different way. Now we know where to go with you.
Yeah, exactly. Look, we all had different starting points in our lives, and I think those of us that had a really great starting point and great support, great families. I think it's easy for us to look at other people been in prison and be like, "Oh, they just didn't make the right choices." But let's be honest. If we're really being honest and we look at maybe where some people start at and where others start at, the support they have, all of these things impact that, right?
Hmm. Absolutely, absolutely. And I will say that, even some people who do get ahead up in life and who do start in good places, they don't always take the right path either. And so it's, but prison jails, they can be a chance for rehabilitation. And I think this is something we would need to change on a more global macro concept of, you know, what does it mean to be incarcerated? Do we want this to be, you know, rehabilitation, right? Uh, not just something that's going to house people for a certain amount of time until you've done your time and that's it. Part of, corrections, right? The word is, it's right there. Can we correct some of this behavior? Can we work towards seeing why this is not being corrected, right? And so very powerful. And for any newer therapist out there, I highly recommend the experience. I would do it again in a heartbeat.
Yeah. Incredible that you're able to do that and have that kind of experience and rehabilitation 100%. But also, you've seen how it can spark other things, right? Like healing, human connection. So, rehabilitation is one part of it. But I can imagine, even from speaking with a good friend of mine, as we've discussed, he has an incredible human connection now today that he never had before, which is
Mhm.
incredible.
Yeah. When you're incarcerated, it really does give you an opportunity to reflect on your life. If you want that opportunity, it's there for you. And what we as therapists can do is foster that healing, and help people connect with their core and say, okay, like, how did you get here? And is this the sort of path you want to keep going down? Because there are people who, unfortunately, they're not there yet and they will continue to sort of be in and out of the system. But then you find that person who's like, no, this can never happen again.
Yeah, exactly. And as I'm listening to you today, I'm thinking two things stand out for me, right? When we talk about even the therapy at a basic level, which is
Mhm.
the power of speaking out and getting started, right?
Uh-huh.
With even creating the dialogue and doing this, and really also making therapy universally accepted for all of us, because I think it's been such a stigma for so long. Oh, you don't need therapy. And again, it's changing, as you said, with Gen Z, which is great because as they get older, they're going to have kids and hopefully they're going to pass that on to their kids that it's okay to talk about these things. So many people carry around emotional baggage or
Uh-huh.
emotional pain in silence, right? Often believing that their struggles aren't serious enough to share. But what would you say to that?
So You know, I everybody has to find the courage within themselves. Everyone has to find the courage within themselves. Uh, I can never, you know, one thing I dislike and won't take in my practice is when somebody else calls saying, "Hey, so and so needs help." Um, I'm like, "Okay, well, have them call me." Or my partner needs help, my spouse needs help, my child needs help. I want to talk to the individual. That tells me a little bit about your motivation for how much you want this. Um, you have to want some sort of change in your life, and if you're not there yet, that's okay, right? That's okay. Listen, I'm not. My job is not to force anybody to be in therapy. My job is not to force you to change any of your behaviors. My job is not to put my sort of take on your life or to live your life for you. Um, I want to teach you how to find that within yourself, and so when you're ready, you will reach out. You will come. You will be there. Um, and sometimes that just takes a little more time for some people than others.
Yeah, and we hear this a lot. You have to want to do this. You know,
Mhm.
you see it sometimes. I've seen it with friends of mine and their families, unfortunately, who had a child who got addicted to drugs, and they did so much for them. But at some point, I guess in all of these journeys that people go through when they're struggling, at some point they're going to have to say, "This is I want to change, and I want to do this to be better. I want to fix this." Right?
Yep. And there's different philosophies about this even, because it's like, yeah, that child who is struggling with drugs, it is hard to sit there and tell a parent, like, this might be as good as it gets for the moment, and we have to tolerate and accept that. But the other side of it is, can we plant the seeds, right? Can we plant the seeds? Okay, you might not get this now, but will that seed sprout in 5 years, right? And so, again, this is where it will be very individualized, but it's there has to be some internal motivation to want to create some sort of change, and that can be found through the therapeutic process. That can be found through, so some people just have the drive naturally.
Yeah. I'm very curious though, because when I'm listening to you today and I'm thinking, okay, so why is talking about our problems as humans? You know, I think we're social creatures. We all know
Mhm.
that. But why is simply verbalizing it and talking about our problems so transformative, right? Even for people who think that they're doing fine, whatever
Mhm.
fine is, you know?
Our bodies do not like to hold on to stuff. We're not designed to hold on to this stuff. For anyone who's ever, experienced like a tremendous amount of stress, or let's leave conditions out of it, but even just stress, just your average stress, our bodies don't like to hold on to this stuff. They want to release it in some way. They want to get rid of this stuff. Our brains don't like to hold on to all this negative stuff. The trouble is we haven't always, maybe through our upbringings or all sorts of situations, we haven't figured out what's the best way to do that. And so by talking about the problem, you're actually releasing stuff from your body. Um, for anybody who's felt anxious, you know that you can physically feel that in your body. There is a physical sensation that goes on with that. There's a relief that can happen when you're no longer anxious, right? So talking about our problems, and I know there's I know there's a study out there on this. I can't quote it off the top of my head, but that talks about what it does to the brain and what happens and changes in the brain when you talk to somebody, when you release it from your body, because that's what we're really looking for, right? Is to unburden ourselves. And I love that word unburden, right? Because it's like our bodies were not designed to carry all of this burden. And so if we are struggling with stuff, talking, we think about it. When you're having a bad day at work, you want to gossip about the person who was causing you trouble. If there's difficulties in your marriage, you might want to talk to your friend about that, right? If you're struggling with like a health issue, right, you don't want to keep that stuff inside. Now you may not know what to do with all that information, but our bodies want to release it on some level, and talking about it is our body's way of beginning that process, saying like, what do I do with this information? It's just sitting there in me. So,
Yeah, exactly. And even people normal, as we said, people like I feel I don't really have I have a great life. I have an incredible wife. I have a huge amount of social connections, men, women, older, younger, different cultures, different ethnicities. And that is wonderful because I talk to this entire social group a lot. And I
mhm.
feel like a lot of this is just communicating, right? And not harboring this and keeping it inside. And even at a basic level, we've all heard this, right? Like your parents or your therapist or your sister, your brother, your best friends, they may not be a licensed therapist, but I think it's the initial steps to embracing the benefits of simply talking through their experiences, right? With someone they trust and then
Mhm.
taking it maybe to another level. But that might be just an easy, low hanging fruit way to get into that, right?
Absolutely. We forget about all the unlicensed therapists who parade around in our lives. Our barbers and hairdressers, our bartenders, our friends, our family, right? These people serve as therapists in our lives. And yeah, it's really, those can always be good steps. If you're talking about it with those sorts of people in your life, sometimes they might even say, hey, maybe you should get some professional help for this. And that gets people thinking as well. So, yes, our bodies by nature are designed to be social.
Yeah, which is great. And again, we're social creatures.
Yeah.
We need to get that feedback. So, Lenny Gallo, thank you for sharing your expertise today. This has been amazing. Your perspective, I love it. Your time with us, the work you're doing is definitely making a real difference in helping people. Today, we talked a little about, overcoming anxiety, obsessive compulsive disorders, breaking that down a little bit, trauma, and, life changes by combining proven therapy techniques, which is what you're doing every day, and is incredible because it's also a very unique approach. It's relatable. So thank you for joining us on Doc Stars.
Thank you so much for having me.
I love it. What a great conversation. So before we go, I'd like to leave our audience with one key takeaway, which is one of my favorite things to do. It's really important to remember this, that therapy is at its best when it's tailored. It's grounded in evidence, which is what we try to do at DocPod. We want to be evidence-based, data-driven, and it's enriched by empathy. And Lenny Gallo is demonstrating that by blending these incredible modalities with creativity. I also love that he's blending them with lived experiences, which matters as real practical application. Therapy becomes more than just treatment. It becomes transformation. So whether online or in person, which we discussed today, connection is the catalyst for meaningful change. So a special thank you to Lenny Gallo. And for those watching and listening, please like and subscribe so we can continue bringing these incredible conversations with fantastic healthcare leaders from around the world. And remember to follow the DocPod channel because health is everything.
Celebrating the world's best. This is DocPod's Doc Stars.